Implementing a national pharmacare plan in Canada. To begin, I would like to outline the current healthcare and drug care system in Canada. Canada is the only developed country who has a universal healthcare system, but not a pharmacare plan. The current drug plans in Canada are public-private insurance plans, employer-funded drug plans, and government-funded assistance plans for the elderly, disabled, and low-income families. In comparison, some countries who have implemented a national pharmacare plan are Germany, the United Kingdom, France, New Zealand, Australia, and Sweden. These countries have a different approach when it comes to providing prescription medication for its residents. All residents have the right to the same quality care and availability for prescription and medication. In order to implement a national pharmacare plan in Canada, many things must be considered. This plan must be safe and efficient. The benefits must outweigh the negatives in order for it to be considered a step in the right direction in terms of prescription medication. In order to have a successful system, I believe that the system must follow a similar principles to the Canada Health Act. The principles which must be highlighted are universality, comprehensiveness, accessibility, portability, and that it is publicly funded. This plan must be accessible in all provinces and territories, and it must allow the individuals to use these benefits if they travel to different provinces or territories. It will also be funded by the federal government, and it should be based on medical needs rather than ability to pay. However, it will not be easy to introduce a national pharmacare plan. There will need to be transition stage. The base of this plan will be from the already existing Canadian Drug Agency and will build from there. This will be a temporary model until further action is taken. Overall, by implementing a national pharmacare plan in Canada, it would reduce the financial burden on individuals as well as the government. Most of the current drug insurance plans are based on the income of the individual. People are placed in difficult situations when they don't have the funds to pay for their medication. This leads them to skip medication, resulting in the deterioration of a person's health. Financial stress also causes cortisol levels to rise, which results in a weakened immune system, leading to more illnesses. If the amount of illnesses keeps rising due to the financial stress, it will impact the healthcare system since it will constantly be overwhelmed with patients. The current healthcare system in Canada has many gaps in regards to different insurances and the amount of coverage each individual receives. About 70% of Canadians rely on private insurance plans. They all vary from one another. This also means that about 30% of Canadians are not covered by any type of drug insurance plans. By implementing a national pharmacare plan, it will make the overall system more equitable, considering all Canadian residents would receive the same coverage and they will all be covered under the same plan. Another growing issue in Canada, which has been noted, is the increase in bed shortages in hospitals. There are many reasons as to why this has become an issue. One of these reasons is that individuals cannot afford or do not take their prescription medication as prescribed. This causes a chain reaction due to the fact that if the individual takes their medication as prescribed, it would prevent their amount of hospital visits, which will decrease the amount of influx of patients in hospitals. If a national pharmacare plan is implemented, people will receive their necessary medication, which will decrease hospital visits, resulting in more hospital bed availability and a decrease in hallway medicine. In conclusion, the cost of prescription medication will significantly decrease, and it will make medication accessible to all Canadian residents. The prescription drug costs will decrease for the government over the years. It will be the most expensive to start up, but in the end, it saves the healthcare system a lot of money. All Canadians will have one constant pharmacare plan in comparison to the multiple different plans. Currently, there are many gaps in the system. Patients who have adequate access to medication are less likely to be admitted to hospitals, resulting in less patients being treated, reducing the amount of hallway medicine.